My name is Abigail DeKeen, and this is Landon Brooks, and I'm going to be performing the Deep Tendon Reflex skills video for Nightingale College. Landon, do you agree to participate in my skills video and be recorded for educational purposes?
Yes, I agree and give consent to participate in your video and be videoed.
Okay, so now I'm going to start with my my skills. So first I'm going to open the door, shut the door for privacy, and hand hygiene. Then I'm going to check the patient's wristband for 2 patient identifiers. So can I please have your first and last name and your date of birth?
Landon Brooks, 12/23/2003.
Perfect, it matches. Now I'm going to explain what we are doing. So we are doing an assessment called the Deep Tendon Reflex. This is to check your motor neuron function in your upper and lower extremities. Are you okay with that?
Yep.
Okay. We also do this assessment in pregnant patients to check for preeclampsia. We also may do this assessment for someone who is taking magnesium sulfate to make sure that the medication is effective. So the way we rate this assessment is we have a scale from 0 to 4. 0 meaning absent, 1 meaning hypoactive, 2 meaning normal, 3 meaning hyperactive, slightly brisk, and 4 meaning hyperactive and risk for clonus. Now that I'm done explaining that, the next thing we're going to do is we're going to check the bicep, tricep, patellar, and Achilles tendon. Okay? So I'm going to have you relax your arm, and I'm going to place my thumb on the bicep tendon, and then with the pointy side, we're going to tap. One more time. Try and relax, please. Okay, and that response would be on our scale as a 2, which would be normal. Now we're going to do the tricep, so I'm going to have you raise your arm up here. I want you to see in the video. I'm going to support the arm with my hand right here, and then we're going to tap with the pointy side on the tricep tendon. Okay, that would also be a 2, which would be normal. Next, we're going to do the patellar tendon, so I'm going to tap with my flat side slightly below the kneecap. Okay, and that response would also be a 2, meaning normal. The next thing we're going to do is the Achilles. So I'm going to dorsal flex the foot, use the flat side of my hammer to tap on the Achilles. Okay, so that is also a 2 because I felt his foot slightly push down on my hand. So the next thing I want to talk about is clonus. So clonus, the way we check is we're going to dorsal flex the foot again, and then we're just going to drop it. And with it going down in a smooth way would mean absent of clonus. To know if it's present for clonus would be we would dorsal flex the foot, drop it, and the foot would be twitching like 3 to 4 times, and that would be positive for clonus. And that would also mean my patient could have an increased for seizure or maybe a sign with some other symptoms for preeclampsia. So now the next thing I'm going to do, I'm finished with my assessment. I'm going to ask the patient if he's comfortable. Are you comfortable the way you are?
Yep.
Okay. I'm going to hand hygiene, and I'm going to go chart my findings and document my findings. Thank you.